Hi, everybody, and welcome to today's Two on Your Side Town Hall. We are glad you're with us on this Thursday. I'm Michael Wooten. Kate Welshofer is off today. 849-2200 is the number to call or text. We hope you'll continue to join the conversation if you have any questions or comments for us. Here's a look at what's ahead this half hour. We're going to have a closer look at new at-home testing for COVID. This is easy, it's cost-effective, but can you trust the results? Plus, a once-in-a-lifetime sight in the sky when you'll be able to catch the so-called Christmas star next week. Heather Waldman helps us understand that. And a big win for a local restaurant. Frank Gourmet Hot Dogs helped feed area frontline workers as the COVID-19 pandemic took hold this past spring. And now a big reward for that effort. We're going to talk to one of the co-owners live later on in the show. We do start today's town hall, though, with some breaking news. A second COVID-19 vaccine is getting closer to joining the fight against the virus. Moderna's vaccine just got kind of the stamp of approval from this FDA panel. This was about 30 minutes ago, an advisory panel for the FDA. Now, that agency just needs to authorize it for emergency use. That could happen very soon, maybe today, maybe tomorrow. This comes as Erie County hits a milestone that we hoped we never would. More than 1,000 residents have now died of COVID-19 since the pandemic started. However, there is some encouraging news here locally. So there was another drop yesterday in the number of people in our region hospitalized with the virus. We're right now right there around 500. There's also been a similar decline in Western New York's coronavirus positivity rate. You're looking right now specifically at Erie County. We are back down now to where we were exactly a month ago. So we went up and now we're going back down. Meanwhile, other counties in our region continue to go up. Chautauqua County, get this, up 447% in terms of that positivity rate compared to a month ago. Let's discuss all of this now and get the latest on that vaccine. Dr. John Sellick joins us live. He's an epidemiologist with Kaleida Health and now a friend of the show, a repeat performer. Dr. Sellick, thanks for coming back on. We really appreciate it. The fact that 1,000 people have now died here in Erie County, it is a sobering statistic. And sadly, even with hospitalizations plateauing, we are still seeing a dozen or so deaths a day on average in this county. We'll talk about the vaccine in a second, but first I just want to ask you about the numbers, what you're seeing in the hospitals right now, and are you at least encouraged a little bit that the numbers, it seems, have stopped going up so much?
Yep. Mike, thanks again. Michael, thanks again for having me on the show. Yes, we're a little bit encouraged. If you compare it back to the spring, our numbers are still quite high. But as you point out, we ascended a very steep slope over the course of the last 2 months. And now it looks like we are getting a little bit of leveling out. The last week in particular is very challenging for the hospitals. The beds were full, the ERs were full, trying to find places to put patients, but now it's starting to ease up a little bit. So we're hopeful that this is going to be a consistent trend, that we're actually going to see this level out and then start to go back down. Fortunately, we did not see a huge spike from Thanksgiving. I mean, there was a little bump up, but I think that people we hope were being good with following all the advice for mask wearing and not having big gatherings, and again the better the curve goes that direction, much better for all of us it's going to be.
Yeah, no doubt about that. Erie County Executive Mark Poloncarz made a point today as we start to talk about the vaccine here, reminding people that it will not stop the spread of the virus, especially early on with so few people able to get it. And he says masks are going to be needed for quite a bit longer. Listen to what he said earlier.
The vaccine may not prevent the spread of COVID, but it may protect you. Sounds like it'll protect you, but it may not prevent the spread. So you could catch it and theoretically pass it on to someone else. So we're still going to need to wear masks for many months going forward, including even after you've gotten the vaccine.
Dr. Sellick, how much longer do you think we're going to need to be cautious? And then also, can you tell us about your experience getting the vaccine? I know that you did that through the VA program at the Veterans Administration Hospital. How did it go?
I think we're going to be stuck like this for at least a handful of more months. Unfortunately, we're all indoors now, and that's kind of primed for what allows this virus to spread. I mean, it's spread primarily by the respiratory route. So we were lucky over the summer. We had a beautiful summer and early fall. We were all outdoors, and I think that helped us a lot. And now we've, as typical in Western New York, we've retreated indoors. So that is, that's probably going to work against us until we get a whole lot more people immunized. So I do spend part of my time at the VA, and I had not really planned to get the vaccine in the very first group. I think there are, certainly people who work in the ER, the ICUs, the COVID units were far more needy of this. But I got a call on Tuesday morning from the leadership at the VA asking me if I would be in the first group to, again, bring home the fact that this is a safe, effective vaccine. So I did it. There were 5 of us who got the first dose, myself and 4 other people who are really at the front lines, emergency department people and one of the ICU nurses. And the thing that was most amazing to me is, I got the shot, and the people in the room, reporters and other people applauded. And, I've never been applauded for getting a shot before. And it wasn't until I had the chance to actually step back a little and see what was going on. But I think we're all so weary of this. This has been going on since March, and we're tired of people dying and tired of people being in the hospitals and having to wear masks and things closed down. That this is kind of a sign of a victory that we finally are seeing some light at the end of the tunnel. So I would encourage everyone, when you do get the chance to get the vaccine, to please get it. Don't listen to any of the the quasi-scientific stuff that you hear. This is very well tested. The original vaccine that I got was tested in 44,000 people. The vaccine that was approved today is tested in 30,000 people. Now, obviously, half of those got placebo. This is a very large number of people, a very stringent review by both the CDC and the FDA subcommittees. I can tell you, as you notice, I've not grown horns, I've not grown scales. This was no different than getting a flu shot. I've had no fever, I've had no other symptoms. I had no pain when I shoveled the snow off the walk this morning. So I would encourage people to get the vaccine. Now, the other question you asked is really important, and that is, are we going to have to continue wearing masks? The thing that we don't know about these 2 mRNA vaccines is whether or not they give what's called sterilizing immunity. So, for instance, with measles vaccine, if you get exposed to measles virus, you have parts of your immune system are ready to jump all over it. With these respiratory surface viruses like flu and SARS-CoV-2, we don't know that the immunity from the vaccine will prevent infection. The 2 big trials that got these vaccines approved were done to show that they prevent disease. So it is still possible, and we're hoping that this changes. We're hoping that the data shows otherwise, but it's still possible you could get infected, and even though you're not going to get sick, you could transmit it to others. So until we see more analysis from the data from these trials, we want everyone to continue to wear masks, practice social distancing, and do good hand hygiene, and not assume that you suddenly have a bulletproof vest with this.
Yeah, and just to recap the breaking news for everybody, again, this FDA panel, this advisory panel, now recommending, I should say, emergency use authorization for the Moderna vaccine. So we'll have Pfizer, we'll have Moderna. There are still a couple more in the works, so certainly promising news there. Dr. John Sellick with Kaleida Health. It is always great to see you, and we hope you'll come back on soon. Congrats on the vaccine. A lot of us are jealous, but you deserve it, and thank you for all that you do for our region.
Sure. Thanks for having me. Have a great Christmas and New Year if I don't see you, and everyone be safe.
You do the same. All right, Dr. John Sellick joining us live. Thank you so much. Coming up on our town hall today, a recall that all parents, grandparents, and caregivers are going to want to know about. An accessory sold with a product that you may use every day with your children could cause them serious harm. We'll tell you all about that. And as we go to break, we want to give a big shout out to some local high school students. Look at their names. Today, the State Education Department nominated 25 New York State high school seniors for the U.S. Presidential Scholars Program. It's one of the nation's highest honors for high school students. And we have 3 locals. Emma Klein and Alexander Jorgensen of Amherst Central High School, and then Alexander Hunt of Ellicottville Central High School made this exclusive list. The students are nominated based on academic success, artistic excellence, essays, community service, and leadership. The semifinalists will be notified in mid-April, and then the winners will be notified in May. We wish all 3 of you the very best of luck.